I'm truly honored to be asked to speak this afternoon. We've all heard about the 3 R's. I'm going to be talking about the 3 B's. Begin, be brief, and be seated. I wanted to talk to you about my involvement in the Toronto Central LHIN self-management program. It's been incredible to watch the evolution of the program. Initially, some organizations, individual, ran self-management sessions with no coordinated overall plan. Today, we have this unbelievable program with direction, a clear vision, for all people with chronic health conditions in the Toronto Central LHIN. This has a lot to do with the dedication of CIRCAB and her team's organization and coordination. In addition to being a healthcare provider, my road to being involved in self-management program developed through living with my own chronic conditions. Improving my communication skills with the overall goal of assisting people with chronic conditions was a big motivation for me. If I could educate patients to be able to learn to set realistic action plans to change their behavior and improve their health, along with other healthcare providers doing the same, then we truly would achieve a real transformation. In 2006, I started searching opportunities to be involved in any learning and committees which promoted self-management. And I started actually in Central Toronto on a self-management advisory board. In 2008, I was trained as a master trainer of the Stanford Chronic Disease Self-Management Program. This was great to learn the program and to understand the importance of how lay leaders with chronic conditions themselves could help the program sustain. In 2010, as the Toronto Central LHIN's Diabetes Regional Coordination Center came to be, I had the opportunity to be the member on this committee representing self-management. They hadn't even hired any of the staff yet. At that time, the Ontario Diabetes Strategy Self-Management Working Group brought together experts from across our province. This is where things started to have an impact. We soon realized to have a program that would grow and support people with chronic health conditions, we required 4 components. First, a team that would organize and coordinate the workshops. Secondly, people living with chronic conditions needed a program that would help them explore their chronic conditions and develop skills to make behavior change. The Stanford Chronic Disease Self-Management Program fit this requirement. Then we needed to put in place a program to support healthcare providers to be able to better support their patients. The following were considered to be critical to a well-rounded program. First, to teach these healthcare providers how to communicate effectively and efficiently with their patients. Secondly, a mentoring program to assist healthcare providers. Mentorship is critical to be able to support the continued improvements. Our self-management program was built slowly, and what momentum we gathered. For the patients, Stanford Chronic Disease Self-Management became the first program. Choices and Change became the program that Toronto Central LHIN chose for how healthcare providers would be trained. And I jumped at the opportunity to be a facilitator. As a facilitator of the Choices and Changes program, I realized that just as patients need to be ready to make change, so do healthcare providers. Being aware of how ready you are to help your patients allows you to work on improving your skills. I found that this motivated me to want to work harder to help people with behavior change. I felt through facilitating I could reach more people with chronic conditions by hopefully sparking the motivation in other healthcare providers. Also, what excited me is that our self-management program grew. We now have 76 Stanford leaders, 10 pep talk leaders, and 12 Choices and Change facilitators. In conclusion, some believe that self-management is not for every patient, or supporting patients is not for every healthcare provider. I believe it should be. The Toronto Central LHIN has a rich self-management community. I am so glad I was part of the ride. I hope as we continue to change the culture in helping people with chronic conditions, everyone will realize to become an engaged self-manager is the way to stay healthy and live their lives to the fullest. I'm excited to see where we go from here. Thank you.